How can we turn this around, and how can all of us celebrate safely this weekend?
That's the big question. To help us answer those questions, we turn to the former commissioner of the FDA, Dr. Scott Gottlieb. Dr. Gottlieb, thank you for talking with us this morning.
Thanks a lot.
So let's dig in here as we head into the holiday weekend. Of course, many experts are certainly very concerned that this pandemic will get a lot worse as millions of people celebrate the holiday. What do you want to say to people when it comes to their July 4th plans and, frankly, staying safe?
Well, look, it's going to get worse before it gets better. And right now we have very pervasive spread, especially in the Sun Belt. The prevalence of the infection is very high down there, so people need to be mindful of what they're doing. I think if everyone is more careful in their daily interactions, wears a mask when they go out, social distances, tries not to congregate in large groups, especially in indoor settings, we can start to turn the tide on this epidemic in the South. But we're slowly losing control of this, and we only have a narrow window. I think in thinking about July 4th, people need to be mindful of what's going on. So if you're going to have some guests over, make it a small social circle, people you trust, do it outside, not indoors. Wear a mask if you're in a group. The congregating indoors in these indoor settings in large groups is really where this spread happens. A lot of the data now shows that the large outbreaks have emanated from people who have large indoor gatherings. So that's something we should avoid. Remember, a lot of these chains of transmission that we're seeing now, this didn't start 2 weeks ago. This started 4 or 6 weeks ago, and a lot of folks trace it back to Memorial Day when these chains of transmission got lit. So we don't want to repeat on July 4th of what happened around Memorial Day when people sort of went out, let their guard down, and then transmission started again.
Now, I know you're calling the latest spike an epidemic, whereas 2 weeks ago you were calling it an outbreak. What's the difference? Are things getting worse, and when could the worst of this be over?
Yeah, that's right. I mean, 2 weeks ago, we weren't sure where we were with this. We weren't seeing exponential growth in these states. Now we are. So this is really an epidemic. We don't have control of it, and it's continuing to build. We'll see case counts continue to go up, at least for a couple of weeks, and we'll see hospitalizations continue to go up. And unfortunately, I think we're also going to see the number of deaths start to rise again. We're going to need some dramatic action to intervene to sort of reverse these trends. You're seeing states take actions at a policy level to close certain congregate settings like bars, entertainment venues, but that might not be dramatic enough. I think if we're not going to shut down again, I don't think we will, and I'm not necessarily saying we should, but if we're not going to issue broad stay-at-home orders, and I don't know that we can, given the vulnerability we have now. Last time this happened was a strong economy. Now we're in a weaker position. But if we're not going to do that, what we need to draw on is a collective action of individuals. We need everyone to adhere to masks. We need people to socially distance. We need people to avoid congregate settings. We need people to reduce their social interactions and their shopping. If everyone does a little bit to sort of take down the level of interactions they have on an aggregated scale, that can have a big impact on the epidemic.
You mentioned wearing a mask. It's become somewhat of a hot button issue, really politically, which I didn't realize would happen. But of course, we're seeing more people talk about the importance of wearing one, as you just mentioned. On Thursday, in fact, Texas Governor Greg Abbott issued a statewide order that face masks be used in public for most of the state. And other states have mandated them as well. Do you think that masks should just be mandatory?
Well, I do, and I've long thought that. I think it's the simplest thing we can do to try to preserve the things that are important to us. Opening our schools in the fall, trying to keep our businesses open where we can, trying to have some level of social interaction, but do it safely. CDC needs to change this guidance. Right now, the guidance on the CDC website says you should wear a mask when you can't socially distance. People don't know when they can and can't socially distance once they leave their home. So we should have broad orders to wear masks in public for the duration of the epidemic. And this is going to course its way through in the next 4 to 6 months. We have a limited time to deal with this. We should try to deal effectively with it because we're going to get beyond this one way or the other. Either we're going to get a vaccine or there's just going to be so much spread, we'll have a level of herd immunity in this country. So this is a defined period of time. We should do what we can to control it. Masking, universal masking is the simplest thing we can do to try to reduce the rate of transmission. There's now been a lot of studies that show if you get anywhere between 50 to 80% of the population wearing reasonable quality masks, you can effectively reduce the rate of transmission below 1. I know that's debatable in terms of just the magnitude of the impact of the masks, but what's unmistakable is the masks will have an impact in reducing the scope of the epidemic if you can get a lot of people adhering to it. And quality of mask matters. So if you can get your hands on a better quality mask, that's going to afford you more protection.
We only have about a minute left, but the current FDA commissioner says that we're on track to have a vaccine against the coronavirus by hopefully the end of this year or early 2021. As the former head of the FDA, do you think that this timeline can realistically happen? I should also note that you're also on the board of Pfizer. Is there anything you can tell us? Do you think this is really going to happen soon?
I think all the data that's been disclosed by the manufacturers, including Pfizer, demonstrates that we should be able to develop a vaccine against coronavirus. The vaccine constructs that we're seeing being developed are immunogenic, meaning that they do generate neutralizing antibodies in people when they're put into people. Now, these studies are small, but we're all encouraged by the data that we should be able to develop a vaccine against this virus. But I think we need to count on a vaccine being an early 2021 event. If we have the vaccine available before then for a select population, that's possible. But I think in terms of doing the large-scale trials, getting results, getting the long-term follow-up data that demonstrates the safety of these products, and then being able to produce them at scale and distribute them, I think that we're really looking at an early 2021 event, probably the first quarter of 2021 in an optimistic case. And so that means we need to get through one more cycle with this. We're going to need to get through fall and winter with this virus. And so that means doing everything we can to reduce our risk to keep this from becoming epidemic again.
My goodness, I sure hope so. A lot of good information, Dr. Scott Gottlieb. Thank you for your time this morning.